before we do, we want to thank our sponsors. We had a number of organizations and companies help us, including those on the board. I'm going to read off a number of them here. Herbs of Love, LifeWave, Every Cell, Every Body, Noise Fresh CBD, Silent Majority Foundation, Moms for Liberty Spokane, React 19, Informed Choice Washington, kind of our big brother in all of this that we do here. Such a great organization. They're also, the flip side of that organization is Children's Health Defense, Bobby Kennedy's organization, the Washington chapter, the same people here for Informed Choice Washington. Pacific Northwest Wellness Center, doTERRA Essential Oils, and Moses Lake Professional Pharmacy. Thank you so much. One last thing, we can bring up the QR code here. This QR code, if you link to this, it will give you it'll take you to the website to provide some donations to what we're doing. So we're gonna flash it up either now or later. Just look for it. If you see that QR code, please get on there and donate. Truth and Accountability Project Washington. This cost better part of $10,000 to put on, and it was funded essentially by the people that you're looking at around this room that have these little badges on. So this is all voluntary. We're just asking to kind of recover some of those costs, but it's something we felt compelled to do for the community. Thank you.
So the current situation is this. If you have COVID and you end up in the hospital, you're put on a rigid protocol, and there's high mortality rate in the hospital, and your family is kept in the dark as to what's happening. So what's going on here? Number one, the CARES Act is providing bonus payments to hospitals whenever you have a diagnosis of COVID. And then number two, the Center for Medicare and Medicaid Services is waiving patient rights. This is a deadly combination. So here's what happens. You get a payment because you offer a free COVID test in the emergency room. You get a boost payment if you have a diagnosis of COVID. Number three, you get another bonus payment if you are admitted with COVID. Number four, you get another bonus payment if you're put on remdesivir. Number five, another bonus payment if you're put on a mechanical ventilator. Number six, another 20% bonus if the diagnosis on your death certificate says COVID, even though you may not have died from COVID. And then number seven, there's bonus payments to coroners. Do you understand the gravity of what's happening right now? The Biden administration is literally paying hospitals to kill you. That's what's happening. This is terrible. We need to stop that. These are real human lives we're talking about. They're priceless. It's estimated at about $100,000 per patient is what the hospitals get. Think about that. Ladies and gentlemen, the real news of right now continues.
Hello, everyone. It's a dose of Dr. Groove.
I don't think that was on mic. Clicker is up here. Oh, and the speaker, this is working. This is great. So I'm going to give this to our next speaker. And again, I could sit here and read through this long paragraph about Dr. Mary Bowden, but I'll let you do that yourself. I do want to say an incredible thing about, again, my fellow colleague and hero in all of this. She turned down standing behind JFK to come speak to you folks. RFK, excuse me. RFK. Junior, okay, or Bobby, okay. So the next speaker, Dr. Mary, please welcome to the stage.
Thank you so much for having me, and I do have to correct a bit of misinformation that Carl just spread, because I was invited to go stand behind RFK in 2 weeks in DC, and I said, well, no, I mean, but I am nonetheless very glad to be here. And actually, so I live in Houston, Texas, but my mom lives here, and my grandparents moved here in 1952, and then my great-grandparents moved to Leavenworth in 1904, so this place is very special to me, and it's very excited to be here. I met Carl through Sean Needham, who has a booth out there, Sean and Janet, Moses Lake Pharmacy. So they owe sort of the credit for me finding my way to Carl. So I am going to just go over my story as a sort of example of what happens when you speak up, or what did happen, and hopefully the journey that I've gone through will give you some more insights. All right, so these are my 4 boys, and they changed the way I practice medicine. This photo was taken 8 months before the pandemic started. And when this photo was taken, I was a full-time mother. I was not practicing medicine. I had 4 boys in 5 years and became a little overwhelmed. So I took time off from work, and I wasn't sure I was going to go back. But then as they got older, I decided, well, I'm going to go back, but I'm going to do it on my own terms. And I was very frustrated in my first practice out of residency with the insurance companies. I hated the stranglehold that insurance companies had, their interference between me and the patient. So I decided, well, I'm going to do something unique, and I'm going to do just direct specialty care. I'm an ear, nose, and throat doctor. So I'm not taking insurance, but I call myself third-party free. So I don't contract with insurance companies, I don't contract with the government, and I don't contract with hospitals. The only people I work for are my patients. And this proved invaluable during the pandemic. It was risky because there's a growing movement of direct primary care doctors that many of you are probably familiar with. But as a specialist, to do this kind of practice model was unusual, and I was told by many people I shouldn't do it. But it really gave me the freedom to be a doctor during the pandemic. And I stumbled into COVID. I remember when it first came out thinking, oh, well, this is all on the news. I'm not going to be affected by this. This is just something that's going to happen in the hospitals. And then people started trickling in, and hydroxychloroquine, I started using that, but then the Texas State Board of Pharmacy literally shut it down. Like, you were not allowed to prescribe it for COVID. And unfortunately, that ban was temporary, and I didn't realize the ban was temporary. I just sort of put that on the back shelf, said, okay, we can't use hydroxychloroquine. And so I would use breathing treatments, I would treat them with antibiotics, steroids, that sort of thing. But most of the time I would just say, well, go to your primary care doctor, because I'm a specialist, and that's their domain. And as we all know, the primary care doctors would say, well, don't come in, just hang tight, and then if you can't breathe, go to the emergency room. Well, that didn't sit well with me, and so, I started treating these people. But the other thing that really got me deep into COVID more than I thought I would is COVID testing, and the reason is I was using a lab called Microgen DX that was doing PCR testing for sinusitis patients, and it was for bacteria and fungus. And that's actually is very helpful for chronic sinusitis patients, really nailing down what the pathogen is in the sinuses. And then they came out with a saliva test for COVID. And so this was great because it didn't entail a jab up the nose. And we also were able to get our results back in 24 hours. So early on, LabCorp was the first lab to do the test, and they got just inundated. They had completely slammed. It was taking 2 weeks to get the test results back. And you may remember that they rationed the testing early on. So when we came out with this test, we were slammed. And you can see that table is getting ready we were doing like 400 tests, and I had 1 or 2 employees. It was insane. My clinic is also in a strip center, which I did purposely because Texas is home to the largest medical center in the world, and it's like going to the airport when you go to the medical center. So I wanted something very easy to get in and out of. But that again served me very well because we could just hand people a cup, they would spit in the cup, and then they would leave it in that little basket right there. And it was contact free. But that made my clinic really explode. And so I started treating, and then monoclonal antibodies came about, and those worked great. And initially I could order as many doses as I wanted, and I'd get them the next day, and people would turn around very quickly. Well, slowly but surely, the government started rationing the monoclonal antibodies. They become much harder to get, and they eventually shut them down, as we know. So that's when I started using ivermectin, and I was cautious about it. First and foremost, I made sure it was safe. I went to the FDA's original study where they had to submit to the FDA to get approved, and I really dug into the data to make sure it was safe. Then once I was assured it was safe, I started using it, and I was a little trepidatious. I'm not sure it's going to live up to the hype. But what I found is it works just as well as the monoclonal antibodies. And all in all, I treated over 6,000 patients during the pandemic. So I had extensive experience, both with the monoclonal antibodies and with ivermectin. Well, as we know, the shots came out, and that was December of 2020. And the government couldn't have people using ivermectin when the shots were out. And it was, as people were hesitant to get the shots, they started ramping up their anti-ivermectin propaganda. It started in March, and you can see this is the FDA's website where, this is a government website with a picture of a horse on it. It's insane. But it says you should not use ivermectin. We know the story, right? They basically branded ivermectin as a horse drug. And you don't need a lot of words, you just have the picture of the horse. And it was masterful, it was clever, they were very successful at it, but it had dire consequences. So March 2021, the government's nervous because only 20% of people have received even 1 dose. So they gotta ramp up their act. So they start churning money. And does anybody know how much money they spent on propaganda? It was a total $11.5 billion on propaganda. And this went to all these social media groups, 275 different groups. The web is so complicated, it's virtually untraceable. But the day, and I call it blitzkrieg, because this is the day, April 1st is when they just went all in. And it started in Houston, where I had privileges at this hospital, Houston Methodist. They declared they were making all their employees get the shots. And this was early, so Biden didn't do this till September. And they were the first to do it. It was still EUA status, was not approved, not licensed. In the same day, Biden announces the start of the COVID Community Corps, which is, this program was $10 billion. He'd already thrown $1.5 billion. So, and then the same day, Rochelle Lewinsky said that if you're vaccinated, you can't get COVID. And on the same day, mainstream media just all at one time, all different channels said that the COVID shots are safe and effective. So just to give you a sense of where we are during COVID, this was the 3rd peak. This is, let me back up. So the propaganda went out in that spring, and then everybody started getting sick that summer. So people their propaganda worked because they went from 50% to eventually 80% of people getting the shots. But the COVID shot didn't work, right? So we kept seeing people getting sick and going into the hospital. And personally for me, and for a lot of people, everything hit the fan in the fall of 2021, which is where that arrow is pointing. So August, again, people are not getting as many shots as they would like. So August 23rd, Pfizer gets FDA approval. At the same time, the FDA puts out the infamous tweet. It went viral. It was their most famous tweet ever. And I would argue the most dangerous tweet that's ever gone out. Following the tweet and the FDA approval, just a flurry of mandates across big companies in America. This is that famous Rolling Stone piece where, I don't know, you're probably familiar with it, but that picture is not people trying to get help with COVID. It was a total fabrication. At the same time, they were raking Joe Rogan through the mud for taking ivermectin. And then September 9th is the day that Biden announced the mandates for most of the country. At the same time, monoclonal antibodies went away. And you can see on the right side there's an email I sent to HHS. Where is my Regeneron? Where are my monoclonal antibodies? I can't get it. I don't think that email ever got answered. Monoclonal antibodies are gone. So October, I start trying to help this patient, Jason Jones. He's in the middle. He's father of 6, sheriff's deputy, and he goes in the hospital in September of 2021. And after a month of being on a ventilator, the hospital's talking about hospice, ready to give up, and his wife is not putting up with it and decides she's going to sue the hospital to get him ivermectin. So she contacted me to be the expert witness to fight for him, but through the legal system, and I agreed. It was a battle, and initially, so the lawyers who did this case had experience in multiple cases. They did 189 cases throughout the country of similar situations, and their strategy was find a doctor like myself, get that doctor privileges at the hospital, and then that doctor can prescribe the ivermectin. And that was the same with me. Initially, the judge granted me privileges, and then the hospital immediately appealed, and they won the appeal, and he was never allowed to get the ivermectin. But you can see on the right, the hospital tied up his feeding tube with a towel just to make sure that no one would get sneak something in there. So this was October. In the meantime, I'm seeing all these patients who've been vaccinated who are sick, if not sicker than the patients that are unvaccinated. I'm actually collaborating with Houston Methodist with doing research, COVID research. I was giving them all my data. We were trying to publish it. We had a seemingly good relationship at the time. I went to them, I said, hey, are you seeing what I'm seeing? Because these shots don't seem to be working. And they gaslit me. They basically said, oh, it just lowers its severity. So I started speaking out on Twitter. And for those of you who are on social media, I had 0 followers 5 years ago. And now I have 440,000 followers. So you can make a difference if you go that route. What happened, I had one Friday where I got turned down at the hospital that we were fighting to get me privileges. Even though we had a court order saying that they had to grant me privileges, the hospital turned me down. And then I got a call from a distraught patient, and she said her urologist at Houston Methodist was not going to treat her because she wouldn't get the vaccine and she had bladder cancer. And then I had a surgery center send me a letter saying that I had to be vaccinated to operate there. And that all happened on one day. So I sent out this email to my patients basically saying I am prioritizing the unvaccinated and I will only be taking unvaccinated patients going forward. Well, I never upheld it. I was making a statement, but it caused a lot of ruckus. But good and bad. I had very strong reactions on both sides. So a few days later, I tweeted this, and simple statement, vaccine mandates are wrong, and I put a testimonial from my patients in response to my email, and I tweeted this 25 times in one day. Same thing, same message over and over again. And then 5 days later, I get this text message from a reporter at the Houston Chronicle telling me that my privileges were suspended from Houston Methodist for spreading dangerous misinformation. And I was blindsided. I did not get a phone call or anything from Houston Methodist warning me of this. And you can see in my reaction, it's like, no, I don't know what you're talking about. And then I go on Twitter and the hospital is tweeting about me. And the story basically went global. I mean, I had people in Australia calling me horrible names. And you know, I was this solo doctor in a very quiet practice in Houston. This is not anything I ever expected to happen to me. So this just showing the news, it went all over the news. It was a struggle session, if you're familiar with what the Chinese like to do to people that are dissenters. It's basically an online struggle session. And then I got reported to the medical board because I resigned from Houston. Well, the next business day, I resigned from the hospital. And then they turned me in because I resigned while under investigation. And then they also, the hospital where I fought for the Jason Jones, the patient that was dying, they turned me into the medical board. So, and unfortunately, I'm still fighting that. So we are now at 3.5 years from those complaints and $225,000, and I am still fighting the Texas Medical Board over these two hospitals. But I want to give you an example of what life was like in the clinic trying to get our patients ivermectin. This is an example of our pharmacy list of just, you know, you see the scratch outs and the write-ins, and we were just always scrambling to get our patients ivermectin. Even to this day, unfortunately, it's still an issue. I got a text message an hour ago from a patient who's traveling. He can't get the ivermectin because he's in Pennsylvania, and he can't walk into a CVS and get it. It's really, really pathetic. So we sued the FDA, which is myself, Paul Merrick, who's with FLCCC, and Robert Apter, who's an emergency room physician in Arizona. The three of us got together and sued the FDA over their misinformation, over those horse tweets, because the FDA is not allowed to give the public medical advice. Their role is to approve medications and then move on. They're not allowed to tell you what you can and cannot take for a certain condition, and that's exactly what they did with the horse tweet. The case was initially dismissed, but then we appealed, and we actually got through on the appeal. We went to the Fifth Circuit Court of Appeals. In the meantime, and this is literally 2 years to the date after Methodists went after me, the Texas governor made mandates illegal in Texas. And then last April, we won our lawsuit against the FDA. Now, all they really had to do was take down the horse tweet, take down the misinformation off their website, but it is very symbolic, and it sets a precedent, and going forward, they are not going to be able to do what they did. a lot of people have criticized us for not going through a discovery and going with the settlement. But as I said, this was not a murder trial. I wish it were. But the objective of our case was to get them to basically take down what they put out there. So in terms of, I have been called every name in the book: pond scum, sister of the devil. But by far the most common is a grifter, right? Because I just took advantage of all those poor COVID patients. But I love this example. So if I had vaccinated the 6,000 patients that I treated for COVID, according to this, and this is Anthem, Blue Cross Blue Shield, this is their incentive program for vaccinating people for COVID, I would have had $1.5 million in my pocket. Oh. And this graph, I feel like it just says it all. The COVID shots are supposed to flatten the curve, but all you do is see it going straight up. I don't see any change in the trajectory. I learned so much, and we could spend another hour talking about it, but in medical school, we are trained that viruses cannot be treated. And I think that was one of the fundamental issues early on with a lot of these doctors in telling people to stay home, because we are trained that you can't treat a virus and you don't want to overprescribe antibiotics. That's drilled into us. But what I certainly found was that yes, we can treat viruses. We have a lot to learn about the vaccines, obviously. I don't trust any of the vaccines now, and I will never get another shot as long as I live, nor will I recommend them to anybody. The FDA and CDC, politically appointed tyrants. I mean, I just inherently trusted them, as I'm sure you all did too, prior to the pandemic, and I see them in an entirely new light. And prior to the pandemic, I was apolitical. I hated politics. I didn't want anything to do with politics, but now I feel like that's our only choice if we're going to see any change, is we have to get involved politically. And there are no coincidences. If you look at that timeline, the whole ivermectin, taking down ivermectin was lockstep with getting a shot in every arm. There's no doubt about it. So what can we do? And odds are you're not going to remember anything from this talk, but I want you to just do this one thing. So I started a nonprofit called Americans for Health Freedom. And our foundational project is to get these COVID shots pulled off the market. I am laser focused on that. There are so many things that need to change, but first and foremost, we have got to stop the damage. And they are recommending 3 shots by the time a baby is 9 months old. The COVID shots, it's unbelievable. 9 months old, 3 shots. So
trying to kill them off.
I have gathered politicians who are willing to simply state that COVID shots should be pulled off the market, and they are also pledging not to take donations from Big Pharma. And this is a graph showing the growth in the movement. Now, the downturn is from the primaries, because we lost people in the primaries. But even yesterday, I think I got 4 more people on the list. So it keeps growing. And we just need to keep the momentum going. And the best way for me to get people to join is for people to directly contact their representatives and ask them to join. And it doesn't cost you any money. It costs you 5 or 10 minutes, and it's easy. And if you could just do that today or tomorrow, and then email your family or like-minded friends and ask them to do the same, then we can make an impact. Now, there's only one candidate in the state of Washington, but he does represent this district, who is on our list, and that is Jared Sessler. Please support him, and then see if you can recruit some more people to join our list. So I am finished. Thank you all so much. I know that everybody in this room has stories, or you wouldn't be here. And I encourage you to share them on social media. Find me on Twitter and say I was at the meeting, and then we can connect. And I love to share other people's stories, but if you contact me through the internet, that's probably the easiest way. So thank you very much.